Hello everybody, and welcome to the English podcast for listening and speaking. I'm Ethan.
And I'm Chloe. We are so excited to have you join us today for another fantastic episode designed to help you boost your English vocabulary and speaking skills.
That's right, Chloe. And today, we're diving into a really useful and practical topic that you'll encounter quite often in everyday life. The world of drugstores and pharmacies.
Yes, whether you're traveling, living in an English-speaking country, or just want to expand your general knowledge, understanding the vocabulary associated with health, medicine, and drugstores is incredibly important. We'll be focusing on terms and phrases that will help you navigate these places with confidence.
We've got a great lineup of words and expressions for you today. We'll cover everything from how medicine is measured, like milligram, to understanding what a price check means when you're at the counter.
We'll also break down essential terms like prescription, capsule, tablet, and overdose. Plus, we'll explore common items you'd find, like eye drops, cough syrup, and bandages.
And it's not just about individual words. We'll also teach you some very useful phrases you can use in many different situations, such as, be sure not to, and, hang on. These are great for polite communication.
So, get ready to learn, listen, and speak English more fluently as we explore the essential vocabulary of drugstores and pharmacies. Let's get started.
Alright, Chloe, let's jump right into our vocabulary warm-up. We're going to start with two very practical terms that you'll definitely encounter in a drugstore or pharmacy.
That's right. Our first term is milligram. Now, you've probably seen this word before, especially on medicine labels. It's often abbreviated as mg.
Yes, milligram, or mg, is a common unit for measuring medicine. It tells you the amount of the active ingredient in a pill, capsule, or liquid dose. For example, if you see a bottle of pain relievers, it might say 500 mg per tablet. This means each tablet contains 500 milligrams of the pain-relieving ingredient.
Exactly. It's crucial for understanding how much medicine you're taking. Doctors prescribe medication in specific milligram doses, so you might hear them say, take one 20 milligram tablet once a day. Or a pharmacist might confirm, this prescription is for 100 milligrams.
So, remember, milligram is all about the quantity or strength of the medicine. It's a very precise measurement, and it's always important to pay attention to it when taking any medication. You'll see it on everything from vitamins to antibiotics. Our next essential term is price check. This one isn't just for pharmacies. You can use it in any store, but it's particularly useful when you're buying health products. A price check is simply a request to verify the price of an item in a store. You ask for a price check when you can't find a price tag, or if you think the price on the shelf might be different from what's ringing up at the register.
For instance, imagine you pick up a box of Band-Aids, but there's no price on the shelf or on the product itself. You can go to the cashier and say, "Excuse me, could you do a price check on this, please?"
Or maybe you're at the checkout, and the cough syrup rings up as $10, but you remember seeing it advertised for $8. You could then say to the cashier, "Could you do a price check on this cough syrup? I think it might be a different price."
So, whether you're trying to confirm a price before you buy, or if there's a discrepancy at the checkout, asking for a price check is the polite and correct way to get the exact cost of an item. It's a very common phrase to use when shopping.
Alright, now that we've got a handle on milligram and price check, let's put some of these terms, plus a few new ones, into action. We're going to listen to a short, realistic conversation that you might hear or have yourself at a pharmacy.
That's right. This dialogue is set at the pharmacy counter. Imagine a customer has just arrived to pick up a new prescription. Pay close attention to how the customer and the pharmacist communicate, and see if you can spot our target vocabulary in a real-world context.
We want you to listen for the words capsule, overdose, and price check within this interaction. Don't worry if you miss something. We'll break it down immediately afterward.
Here's the scene.
Hi, I'm here to pick up a prescription for John Smith. spelled Smith.
Just a moment, let me find that for you. Ah, yes, Mr. Smith. It looks like your doctor prescribed Augmentin. These are 500 milligram capsules. Is that correct?
Yes, that's right. My doctor said it's an antibiotic. How should I take them?
You should take one 500 milligram capsule every 12 hours, with food. It's important to finish the entire course of medication, even if you start feeling better. And be sure not to take more than the prescribed amount. Taking too many could lead to an overdose.
Oh, overdose. Got it. So, just one capsule every 12 hours. Understood. What's the total cost for this prescription?
Let me see. For this prescription, the total is $35.50.
I thought it might be less. Could you do a price check on that, please? I believe my insurance should cover more of it.
Certainly. Let me just confirm your insurance details again. Sometimes there's a slight delay in processing. One moment. Ah, yes, it seems your copay is actually just $10. Thank you for asking for that price check. It looks like it wasn't fully processed initially.
Perfect. That makes more sense. Thanks for checking that.
No problem at all. And just to remind you, if you experience any severe side effects, please contact your doctor immediately. Do you have any other questions?
No, I think that covers everything. Thank you.
You're welcome. Have a good day.
Wow, that was a great example of a common pharmacy visit. Did you hear those key terms?
Absolutely. The pharmacist mentioned capsule when describing the form of the medication. And they also gave a crucial warning about overdose.
And the customer very effectively used price check to ensure they were paying the correct amount, which, in this case, saved them quite a bit of money. It just shows you how useful that phrase can be.
We'll dive deeper into each of these terms, as well as some other important vocabulary from that dialogue, right after this.
Welcome back. That dialogue really packed a punch with some essential vocabulary, didn't it? Now, let's take a closer look at some of those terms, plus a few others you'll definitely encounter at a pharmacy.
First up, a term you heard right away, prescription. A prescription is simply a written order from a doctor that you need to get certain medications. It's like a special note from your doctor to the pharmacist.
Exactly. You can't just walk into a pharmacy and buy everything you need. For many strong or specialized medicines, you absolutely need a prescription. For example, I need to pick up my prescription for antibiotics, or, the doctor wrote me a new prescription for my blood pressure medication.
Moving on to the forms of medicine. You heard the word capsule in the dialogue. A capsule is a type of pill that's often tube-shaped or oval, with a smooth, typically gelatinous, outer shell. It has the medicine inside and is often easier to swallow than some other forms.
That's right. Think of it like a small, smooth container for the medicine. For instance, this allergy medicine comes in the form of a capsule, or, the doctor told me to take 2 capsules before bedtime.
Then we have tablet. While a capsule is often tube-shaped, a tablet is typically a flat, round, or oval-shaped pill. Many pain relievers, like aspirin, come as tablets.
So, you might say, I prefer taking tablets over capsules, or, this vitamin supplement is available as a small tablet. They're both ways medicine is packaged for you to take, but they look and feel a little different.
Next, a very important and serious term, overdose. An overdose means taking too much of a drug, which can be very dangerous, harmful, or even fatal. It's a critical concept, especially when dealing with powerful medications.
The pharmacist in our dialogue specifically warned about an overdose to the customer. For example, be sure to follow the dosage instructions carefully to avoid an overdose, or, they rushed him to the hospital after an accidental overdose of painkillers. It highlights the importance of taking only the prescribed amount.
And finally for this section, let's talk about eye drops. These are a common liquid medicine specifically used for treating your eyes.
Yes, if your eyes are dry, itchy, or irritated, you might use eye drops. You literally drop the liquid into your eyes. For example, my doctor prescribed eye drops for my dry eyes, or, I always carry eye drops with me, especially when my allergies act up.
So, to recap, we've got prescription, the doctor's note for medicine, capsule, a specific type of pill, tablet, another common type of pill, overdose, taking too much medicine, and eye drops, liquid medicine for your eyes.
Knowing these terms will definitely make your next visit to a drugstore or pharmacy much smoother and help you understand important medical instructions. Alright everyone, we've just gone through some really important vocabulary. Now, to help you truly grasp these words and phrases in context, we're going to play that pharmacy conversation again.
But this time, we'll slow it down considerably. This is your chance to really focus on the pronunciation of each word, how the sentences are structured, and the natural rhythm of the conversation. Listen carefully for those key terms like prescription, capsule, overdose, and price check.
Here we go, the same conversation, but at a much slower pace.
Hello, I am here to pick up a prescription.
Okay, can I please see your prescription?
Yes, here it is. It is for my allergies.
Thank you, let me check. Ah, yes, this is for a new allergy medication. It comes in capsules.
Capsules? Okay, how many do I take? You should take 1 capsule, twice a day, with food. Be sure not to take more than 2 in a 24-hour period to avoid an overdose. 1 capsule, twice a day. Got it. What is the price for this?
Hang on a second, I will do a price check for you right now.
Thank you.
So, there you have it. That was the conversation. Much slower, right?
Hopefully, that slower pace gave you a better chance to catch every word and understand how these terms fit into a real-life conversation at the pharmacy.
Alright, fantastic. Now that we've had a chance to really slow down and listen to that pharmacy dialogue, let's zoom in on 2 incredibly useful phrases that appeared in that conversation. These aren't just for the pharmacy, you'll hear them all the time in everyday English.
That's right, Chloe. The first phrase we want to talk about is, be sure not to. Did you catch it in the dialogue? The pharmacist said, be sure not to take more than 2 in a 24-hour period to avoid an overdose.
Exactly. So, what does be sure not to mean? It's a very polite and softer way to tell someone not to do something. Instead of saying a direct, don't do this, which can sometimes sound a bit harsh or like an order, using be sure not to is more like a gentle warning or a strong recommendation. It emphasizes the importance of avoiding a particular action.
Think of it as a friendly reminder, but with a clear instruction attached. It's about being careful and making sure you avoid a specific mistake or consequence. We use it when we want to warn someone or give them important advice, without sounding too bossy.
Let's look at some examples outside of the pharmacy setting. Imagine you're talking about cooking. You might say, when you're baking this cake, be sure not to open the oven door too early, or it might fall flat. Here, it's a critical instruction for success.
Or maybe you're giving directions. You could tell someone, when you get to the crossroads, be sure not to turn left, because that's a dead end. It's an important piece of information to help them avoid getting lost.
Another common context is safety. If you're teaching someone how to use a new tool, you might say, be sure not to put your fingers near the blade when it's operating. It's a crucial safety warning.
And it's perfect for giving advice about habits. For example, if you want to improve your English speaking, be sure not to be afraid of making mistakes. Everyone makes them. It's a motivating piece of advice.
So, be sure not to helps convey a serious warning or important advice in a polite and encouraging manner. It's definitely a phrase you'll want to add to your active vocabulary.
Moving on to our second useful phrase from the dialogue. Hang on, or hang on a sec. You heard the pharmacist say, hang on a second. I will do a price check for you right now.
This one is very common and super informal. Hang on simply means, wait. It's used when you're asking someone to pause or wait for a very short period of time, usually just a few seconds or a minute.
It's much more casual than saying, please wait, and it implies a very brief delay. You wouldn't use, hang on, if you needed someone to wait for a long time, like an hour. For that, you might say, could you wait for me? Or, I'll be a while.
Let's think of some scenarios where you'd use, hang on. If your phone rings while you're talking to someone, you might say, oh, hang on a second, I need to answer this call. It's a quick interruption.
Or if you're looking for something, like your keys, and someone asks if you're ready to leave, you could respond, hang on, I'm just looking for my keys. It signals a very brief delay while you finish a small task.
At a restaurant, if the waiter comes to take your order and you're not quite ready, you might say, could you hang on for just a moment? I just need another minute to look at the menu.
And if you're in the middle of explaining something, and you suddenly remember a detail, you might interject with, hang on, I forgot to mention something important. It brings the conversation to a temporary halt.
So, whether it's, hang on, or, hang on a sec, or, hang on a minute, they all mean the same thing. Wait for a short time. It's a very natural and widely used expression in everyday English conversations.
These two phrases, be sure not to, and, hang on, are fantastic for sounding more like a native speaker and for navigating those common, informal interactions. We encourage you to try using them in your own practice sentences. Okay, listeners, we've walked through the vocabulary, broken down the useful phrases, and even listened to the pharmacy dialogue at a slower pace.
Now it's time to put it all together. For the final time, we're going to play that same pharmacy conversation, but this time, it will be at a natural speaking speed.
This is your chance to really test your comprehension and see how well you can follow along with all the new words and phrases in a real-world context. Don't worry if you don't catch every single word. The goal is to understand the overall meaning and recognize the key terms.
So, lean in, listen carefully, and see how much you can pick up. Here's the pharmacy conversation again, at natural speed.
Hi, I'm here to pick up a prescription for John Smith.
Okay, just a moment. Let me find that for you. Ah, here it is. It is for these capsules. Be sure not to take more than 2 in a 24-hour period to avoid an overdose.
Got it. How much will that be?
Hang on a second. I will do a price check for you right now. Okay. The total comes to $15.50.
Perfect, thank you.
That was a great listen. Now that we've reinforced the practical language, let's shift our focus a bit to some cultural insights around medicine in English-speaking countries, particularly the United States.
Absolutely, Chloe. There are some common phrases and practices that might be different from what listeners are used to in their home countries. Let's start with a very simple but important one. How we talk about consuming medicine.
That's right. In English, when we talk about consuming medication, whether it's a pill, a liquid, or even an injection, we almost always use the verb, take. We take medicine.
You won't hear native English speakers say, eat medicine, or drink medicine, even if it's a liquid like cough syrup. For example, you would say, I need to take my antibiotic, or, did you remember to take your cough syrup this morning?
It's a key distinction. So, remember, whether it's a tablet, a capsule, or a spoonful of syrup, the verb to use is take. Take your medicine.
Next, let's talk about the 2 main categories of medication you'll encounter. Prescription medicine and over-the-counter, or OTC, medicine.
This is a very important distinction, especially if you're traveling or living in an English-speaking country like the US. Prescription medicine, as the name suggests, requires a prescription from a doctor.
That means you can't just walk into a pharmacy and ask for it. A licensed medical professional, like a doctor or a nurse practitioner, needs to assess your condition and write an official note, or prescription, authorizing you to get that specific medication. These are typically for more serious conditions, or medications that have strong effects or potential side effects.
Exactly. Things like strong antibiotics, certain pain relievers, or medications for chronic conditions often fall into the prescription category. This is different from many other countries where some medications that require a prescription in the U.S. might be available directly from a pharmacist.
On the other hand, we have over-the-counter, or OTC, medicine. These are medications you can buy directly from a drugstore or pharmacy without needing a doctor's prescription.
OTC medicines are generally considered safe for self-treatment when used as directed. Common examples include pain relievers like aspirin or ibuprofen, cold and flu remedies, allergy medications, and antacids.
You'll find a wide range of OTC products readily available on the shelves, often in designated aisles, just like other consumer goods. Pharmacists can still provide advice on OTC medications, but you don't need their permission to purchase them.
So, the key takeaway here is, take medicine, is the correct verb, and be aware of the difference between prescription and over-the-counter medications. Always check if a medication requires a prescription before you head to the pharmacy.
And when in doubt, it's always a good idea to speak with the pharmacist. They are healthcare professionals and a great resource for information about both prescription and OTC medicines, even if you don't need a doctor's note for them.
They can help you understand dosages, potential side effects, and interactions, making sure you take your medicine safely. This leads us perfectly into our next segment where we will do a comprehensive review of all the vocabulary we've covered today.
All right, Chloe, that was an excellent deep dive into cultural practices. Now, as promised, let's bring it all together with a comprehensive review of all the important vocabulary we've learned today about drugstores and pharmacies.
This is a fantastic way to solidify everything. We've covered quite a few terms, from specific measurements to types of medicine and items you find on the shelves. Let's start with some of the core medical terms we discussed.
First up, we had milligram, often shortened to mg. This is a common unit for measuring medicine, especially the active ingredients in pills. For example, this pain reliever contains 500 milligrams of ibuprofen.
Next, a very practical phrase for shopping, price check. This is a request to verify the price of an item in a store. If an item isn't scanning correctly, you might hear, "Could you please do a price check on this item?"
Moving on to the types of medication. We talked about prescription. A prescription is a note from a doctor that you need to get certain medications from the pharmacy. You might say, "I need to pick up my prescription for antibiotics."
Then we distinguished between capsule and tablet. A capsule is a tube-shaped pill with medicine inside, often easier to swallow. For instance, this medication comes in a gel capsule.
And a tablet is a flat, round, solid pill. The doctor prescribed a tablet to take once a day.
A very serious term we touched upon is overdose. This means taking too much of a drug, which can be extremely dangerous or even fatal. It's crucial to follow the dosage instructions to avoid an overdose.
And for a common eye ailment, we have eye drops. This is liquid medicine used for treating eyes, typically for dryness or irritation. You might say, "I need to buy some eye drops for my allergies."
Now, let's review some of the other useful items you'd find in a pharmacy or drugstore, starting with syringe.
A syringe is a medical device for injecting or withdrawing fluids. You might encounter them for vaccinations or insulin. For example, the nurse used a small syringe for the flu shot.
Then there's cough syrup. This is a sweet, liquid medicine used to treat coughing. My throat is sore, I really need some cough syrup.
A very common item for minor injuries is a bandage. This is a cloth strip used to cover or support injured parts of the body. You should put a bandage on that cut to keep it clean.
For cleaning wounds, we have hydrogen peroxide. This is a liquid used for disinfecting wounds. Always clean a new wound with hydrogen peroxide before applying a bandage.
And finally, ointment. This is a smooth substance for the skin used to relieve pain or help healing. It's often thicker than a cream. The doctor recommended an antibiotic ointment for the rash.
So, there you have it. A comprehensive run-through of all the key vocabulary related to drugstores and pharmacies that we've covered today. From the different forms of medicine to the items you find on the shelves and even the terms for serious medical situations.
Practicing these words and phrases in sentences, just like we did, will really help them stick. Try to think of situations where you might use them in your own life or create your own example sentences.
Absolutely, Ethan. It's so important to not just learn these words, but to actively use them. Whether you're listening to English podcasts, reading articles, or even just thinking in English, try to spot or incorporate these drugstore and pharmacy terms.
That's right. The more you use them, the more natural they'll become. From understanding a prescription to asking for a price check, these are truly practical words and phrases that you'll encounter in everyday life, especially if you're traveling or living in an English-speaking country.
We hope this episode has given you a solid foundation and boosted your confidence when navigating a drugstore or discussing medication in English. It's all about building that vocabulary brick by brick.
We've covered everything from milligrams and capsules to useful phrases like be sure not to and hang on. Remember, consistent practice is key to mastering new language.
Thank you so much for tuning in to English Podcast for listening and speaking. Your dedication to improving your English truly inspires us.
We had a great time exploring this topic with you, and we're already excited for our next episode, where we'll delve into another fascinating area of English vocabulary.
Until then, keep practicing, keep listening, and keep speaking.
Goodbye for now.